Forward right here, right? Sorry about that N accidentally. We're going to have the left atrium. It also has the papillary muscles. It also has a chordae tendineae connected to them. And when we look at the bottom right here, the other half of that model, you'll see the ridge-like patterning of the cardiac muscle. This is the trabecula carne right here. Now we move really deep inside. You see that letter K? That is that aortic valve that will then open up to the ascending aorta. The ascending aorta then is going to throw blood into the brachiocephalic trunk, the left common carotid, and the left subclavian arteries. Then it's going to terminate as the descending aorta into the thoracic aorta, into the abdominal aorta. Now, on this one, we're going to talk a little bit more about the circulation in terms of its circulation of blood flow in the coronary arteries. So what we're going to take a look at on this model is this right coronary artery coming straight off the aorta and found between the atrium and the ventricle. The right coronary artery is going to give rise to a right marginal branch right here, and it's going to terminate backwards as the posterior descending artery. Now, on that model, we can see it pretty good. On this model, we can see it as well. So in this model, I'm just going to open this model up, right? You'll see the right coronary artery. This is a right marginal branch. And then it continues backwards. All right, so the right coronary artery continues backwards, and it terminates as the posterior descending artery, or PDA. On the left side, we can only see the left coronary artery over here on this model, older model. Right? This coronary artery, the left coronary artery, is just this region right here, comes down, and it gives rise to the left anterior descending and the left circumflex artery. So circumflex, like circumference, it goes around the margin between the left atrium and the left ventricle. This is the left marginal branch, and it continues backwards. Right? Now, the veins also run to the arteries. So we're going to see is, on this model, we see the left anterior descending, or LAD, and the great cardiac vein are all going to follow LAD. And the great cardiac vein is going to go all the way around and eventually turn into the coronary sinus over here. Now, we also have a small cardiac vein, and the small cardiac vein runs with the right coronary artery. So here's a small cardiac vein running with the right coronary artery over here. Small cardiac vein. The middle cardiac vein runs with your posterior descending artery. This is a very good example of a middle cardiac vein receiving the small cardiac vein, and then it's going to fuse with the great cardiac vein, and now we're at the coronary sinus right here. Now, on this model, we also see a very good version of the next and the second fetal connection. So we talked about the fossa ovalis that connects the right atrium to the left in utero. Now, the next kind of anastomosis in utero is this one. This is called the Ductus arteriosus in utero. And after your first couple breaths, even this region starts to become scar tissue. This is the ligamentum arteriosus. Right? In utero, blood doesn't need to go to the lungs because there's no oxygen in the lungs. So whatever blood enters the pulmonary trunk then gets diverted into the ductus arteriosus directly into the aorta. Obviously, when you take your first breaths, you increase the oxygenation in your lungs, and then the pulmonary veins and the pulmonary artery here opens wide. As it opens wide, there's a drop in blood pressure, and blood then can move into the pulmonary arteries. Since ligamentum arteriosus is so small, less blood and less blood goes into that connection, and this becomes scar tissue.